basically, when you talk about drugs, you can talk about small molecules or talk about these complex biological protein-like things, which is a subclass called antibodies. Antibodies are the molecules that the immune system naturally builds to attack disease. Today, the idea that somebody says, oh, here's an antibody, make a lot of it, make it very quickly, that's right on the cutting edge. And the Ebola epidemic showed me that we're not ready for a serious epidemic, an epidemic that would be more infectious and would spread faster than Ebola did. This is the greatest risk of a huge tragedy. This is the most likely thing by far to kill over 10 million excess people in a year. We don't need to invest nearly what we do in military preparedness. This is something where less than $1 billion a year on R&D, medical surveillance, standby personnel, cross-training the military so they can play a role in terms of all the logistics here. This can be done, and we may not get many more warnings like this one to say, okay, it's a pretty modest investment to avoid something that really, in terms of the human condition, would be a gigantic setback. RNA vaccine that people like Moderna, CureVac, and others are using, that in 2015 we'd identified that as very promising for pandemics and for other applications as well. And so if everything goes perfectly with the RNA approach, we could actually beat the 18 months. We don't want to create unrealistic expectations. Here, we clearly need a vaccine that works in the upper age range because they're most at risk of that. And doing that so that you amp it up so it works in older people and yet you don't have side effects. You know, if we have, 1 in 10,000 side effects, that's, way more, 700,000, people who will suffer from that. So the most urgent invention in the world right now is a vaccine that prevents you from getting COVID-19. What vaccines do is they teach your immune system about the pathogen. This is the coronavirus. And this shape on its outside is called the spike protein. It grabs on to the cells in your body that have a particular receptor and get that cell to make billions of copies of this virus. The first time that you're exposed to this virus, it takes literally days for your immune system to realize that it's a bad thing. So how do we get the immune system to go faster? Well, the idea of a vaccine is to give you an exposure to something that looks like this, so you're getting your body to make a lot of antibodies that can take these viruses and actually kill them. There's over 100 different efforts making many different types of coronavirus vaccines. So how do you make a vaccine? Usually you're injecting at least part of the shape of the virus. Sometimes you do the whole virus, but it's attenuated so it doesn't multiply too much. Sometimes you take a virus and you kill it. You won't get sick because they're not duplicating. What's typically done is you just take either a piece of the virus or just the spike, that thing on the surface, and you put it on something else. So there's no risk at all of causing a disease. One final way that's new and is promising is called the RNA vaccine. With RNA and DNA, instead of putting that shape in, you put instructions in the code to make that shape. So the Gates Foundation, along with a great number of partners, are looking at these different efforts. We've never created a new vaccine in less than 5 years. So this is urgent, and it's going to require incredible collaboration. It's going to have to go to 7 billion people. So I am optimistic that one of the vaccine efforts will give us vaccines in the next 18 months. And we'll make sure that it's produced in volume and that it's accessible to everyone in the world. That's how we're going to end this pandemic. The health experts and others like myself are saying, hey, let's not lose sight of this. Even though the weather is helping us a bit, May would have been much worse if the virus wasn't somewhat seasonal. And so we know now that we're benefiting from the summer, and so forced infection will get worse in the fall. So all the more reason not to get completely lax in our behavior. The only good news in this is that the death rate has gone down somewhat as we're learning how to treat people better, we're less overloaded. But the global picture and the U.S. picture are both more bleak than I would have expected. Well, it's almost as though people have a willingness to go into lockdown once and, for a certain period. And that, maybe that's not surprising. Then it takes, to get them to to extend it past a certain thing, or even to inconvenience themselves with masks, requires maybe somebody they know to not only test positive, but maybe get very sick as well. And so the range of behaviors in the US right now, some people who are being very conservative in what they do, and some people who are basically ignoring the epidemic, it's huge. And we've worn out people's patience, and if they don't see it in some way, they some people almost feel like it's a political thing, which is unfortunate. Most of the work we're going to do to be ready for pandemic 2, I call this pandemic 1. Most of the work we'll do to be ready for that are also the things we need to do to minimize the threat of bioterrorism. And